Hey, and welcome to Amplified Wellness Podcast. I'm Chris Barnes, your host. Today, we're going to delve into the world of regenerative medicine, and I'm absolutely excited about our guest. She's a world-renowned expert and pioneer in the field of regenerative medicine. She has a PhD in stem cell biology and is also on the board as a chief scientific officer at US Stem Cells. I'd like to welcome Dr. Kristin Comella. Welcome, Dr. Comella.
Thank you so much. Pleasure to be here.
Absolutely awesome to have you on. It's a field that's fascinating. It's I'm sure for so many of our listeners, it's going to be a world that they're probably not that aware of yet. I know personally for me, only up until recently, the idea of stem cells was pretty far-fetched for me. As a bit like on a sci-fi movie, the idea of a futuristic world, you get an injection, your body miraculously heals. So like some of the information and case studies around stem cells is amazing, and I can't wait to delve into that, into some of the applications. But I guess to set the scene, what would be the best way to describe stem cells for our listeners?
Sure. So the concept of regenerative medicine and more specifically stem cells is that every single one of us has healing potential inside us, known as stem cells. And these cells are constantly at work. So at any given moment, your cells are repairing tissue inside your body, and there's constant turnover. So regardless of your age, you have stem cells hard at work, and they are responsible for making sure that our tissues can still function. So anytime tissue gets tired, or the cells inside the tissue get tired, new cells come, and these new cells are born from the stem cells. So we are, any given moment, have cells circulating into all the tissues in our body. It's really kind of a miraculous machine, the human body, and this ability to heal itself. And so oftentimes we turn to devices or medications, which are great, but sometimes we forget that the greatest machine ever made is our own body, and we do have the ability to heal. So the concept of regenerative medicine, and more specifically stem cell therapy, is to tap into this natural healing ability that's inside of us. And I believe that in our lifetime, it will become common that patients will seek stem cell treatments or regenerative type therapies. And we're already seeing a huge growth of this.
No, absolutely. And your clinic and your work in particularly specialize in fat-derived stem cells from one's own body. Is there a big difference from, I guess, the origin from when or where the stem cells come from?
Every tissue inside your body has stem cells. So you can obtain stem cells from a variety of different sources, bone marrow, teeth, muscle, and of course, fat tissue. One of the reasons that we have really liked working with fat tissue is because it's a very plentiful source of stem cells, and because it's a very easy source to obtain. Cells from fat can be obtained just from a simple mini lipoaspirate. And what that means is just a tiny incision. It's about the size of my pinky nail, where we remove a small sample of fat, and then we can isolate the cells from it. And then, of course, another way to isolate stem cells would be from the bone marrow. It's also a relatively simple procedure, so we can tap the bone to isolate the bone marrow. And because there's so many different tissues that you can obtain stem cells from, there's a lot of different ways that it can be done in a clinical setting. But in all of these cases, it can be done outpatient, which means that a patient come in, they can remain awake during the entire procedure. So in that sense, it's very minimally invasive. Once you obtain those cells, it can be applied back to the same patient. In other words, you're using your own cells. So you don't have any of the ethical concerns with using an embryonic type stem cell or somebody else's cells. And you don't have any concerns of rejection, because these are your own. These are your own cells that exist inside you, and they can then be applied specifically to tissues in your body where you might need it. So just to give you an example, maybe a patient comes in who's having concerns about knee pain. They've got a meniscal tear, or maybe they've got arthritis, or maybe a patient comes in who's suffering from a neurological condition and they're interested in having the cells applied for regenerating tissue in the brain. Or maybe somebody coming in who's suffering from an autoimmune disease. And the reason that the cells could be beneficial in all of these type of conditions is because the underlying issue is inflammation. And stem cells are naturally anti-inflammatory. This is how they work inside your body at any given moment. You first have inflammation, and then stem cells come and repair and quiet down the inflammation.
That's incredible. So do you have to locally administer them, or can you just put them into the body and they just go and do their work?
So both, actually. Be applied directly to where you need them, for example, into a joint, intra-articular, or they could be applied systemically. And what's beautiful about stem cells is they naturally home to areas of inflammation. So if you were to apply the cells, for example, IV, circulating through the vein, they would go to where you have the most inflammation. So maybe you've got issues in your lungs, or maybe you've got issues in your heart. So it really makes it kind of a smart, if you will.
Absolutely fascinating. And I first was introduced to you at Paleo Effects earlier this year, and you were sporting a shirt which was "My Cell, My Choice," which really stood out. And there's a story behind that. And I know that you've been campaigning and fighting for Americans' rights to own their own stem cells from their own body. And not have them declared or classified as a drug by the FDA. How is that going? Because that's mind-boggling that I guess they could declare your own cells a drug. It blew my mind at Paleo Effects.
Yes. So what happened is that the United States of America filed a lawsuit against me, which is kind of a mind-numbing experience to receive a document that as the United States of America versus Kristin Comella, as well as the clinic and the entities that are offering treatments to patients. And they gave me an opportunity to sign what we call a consent decree, which essentially said, I agree to go away and be quiet and not talk about these treatments for patients or offer these treatments in our clinics for patients. And unfortunately, I chose not to go away and be quiet. And the reason I did that is because I've seen enough patients experience the benefits of these therapies. So I felt that it was important to stand up for the rights of Americans to own their own cells, as opposed to labeling a drug in which pharma companies would then take our cells out of our body and sell it to us. That just makes zero sense to me, and it seems like we're putting profit over patients, and it just seems more wrong. So the case never actually went to trial. Instead, the judge sided with the government, never even gave me an opportunity to speak my voice. She never gave an opportunity of our experts to come forward. She never gave an opportunity for the patients to come forward and speak their voice. She deemed it a drug, and so round one, I guess you could call, I lost. So at this point, I just recently filed an appeal about a week ago. It'll be Friday. I filed an appeal to take it to the next level. So it'll go before the appellate court to see if I can win. Of course, the challenge with fighting the United States of America government is that they have unlimited resources, funds to do it, and we do not.
Yeah, it's concerning, isn't it, that like profits and shareholders' stakes in pharmaceuticals can pretty much override one's ability, especially with their own biology. Although, yeah, good luck with that case.
Yes.
Yeah, but so going back to like some of the applications of stem cells. So you personally said that you've had literally through your clinics thousands and thousands of patients benefiting from stem cell therapies. Do stem cells treat all diseases and all conditions, or do they specifically work better with others?
So I don't know that there's enough published at this point to say, which is going to work best versus, more challenging. What we do know is the stem cells can help with an inflammatory process and creating a cascade. So oftentimes we're trying to address our symptoms associated with inflammation and or damaged tissue. So in that regard, it makes a lot of sense to utilize stem cells for just about any condition you can think of, because so many of them have to do with that inflammatory response and helping to stimulate healing cascade. So I think this is one of the reasons that pharma is a little bit nervous about the technology, because we're not masking symptoms, which so many of the pharmaceutical products do. Think about like the opiate epidemic, where all we did was mask symptoms. We didn't get to the root cause. We didn't address the reason that the patient was in pain. In this case, we're actually getting the root cause. We're trying to address the damaged tissue, the inflammation. So I think anything that has the possibility of obsoleting an entire field of pharmaceutical medicine certainly is something the pharma companies would not necessarily know.
No, spot on. Well, you mentioned like inflammatory applications. So pretty much most diseases have an inflammatory basis. So you think neurological, autoimmune, everyone with gastrointestinal issues. So stem cells sound like, a really logical step towards kind of putting out some of that fire within the body. Right. One thing that really kind of grabbed my attention was, I guess, the support with nervous system conditions. So in particular, traumatic brain injury. I was listening to one of your other talks, and you said that you can actually administer stem cells into the spinal fluid and have them go and repair damaged brain cells. Is that correct?
Yeah, so by injecting the cells into the cerebral spinal fluid at the lower portion of the spine, so it's safer, we're below the spinal cord, they will circulate and potentially cross the blood-brain barrier. So once into the brain, they can now address certainly something that's acute, like a traumatic brain injury where we have swelling and a lot of damaged tissue, prior to large amounts of scar tissue forming. So I actually consider it criminal that we are not administering stem cells to every single patient that has brain injury. And I see a future where every Monday morning after, the football game, what's this you guys play in Australia?
We've got rugby league. And
rugby. So after the rugby game, you get your injection of stem cells, and this is going to help to protect any of that future scarring that may occur. And we already know that any sort of contact sport can be problematic for the brain. And there's no reason that we shouldn't be offering these treatments to our athletes and really to anyone who is exposed to a brain injury. So, anything from car accidents, falls, to strokes, you name it. These cells could potentially alleviate that inflammation and prevent that scar tissue from forming.
No, absolutely. Because actually, another guest I had on the podcast was Dr. Dan Engel, and he obviously wrote the concussion repair manual, and it was so alarming the damage that kind of contact sports and any concussion in particular has on the brain, and that cascade that happens directly after. I'm an ex-rugby player, 15 years, and I've suffered multiple concussions. So it's a real area of concern for me, and trying to heal that moving forward and prevent any long-term damage. So it was really fascinating to know that does have an application there. And yeah, it'd be fantastic to see that administered to players. There's still a long way to go in the game, because I see guys getting banged, concussed, and getting back on the field still. How quickly can stem cells be administered if that was to happen?
One of the things that we have done is create tissue banks where we can store the stem cells of each patient. So you have your cells ready and waiting for you. So certainly for somebody who knows that they're going to experience head injuries like athletes, having those cells ready and waiting, kind of getting it right after the game, right after the situation. But even for just the general public, having the cells available should an emergency happen. So even say you have a heart attack, well, now your heart is completely inflamed just by applying the cells IV right at that moment. we can help to prevent any of that scar tissue formation, which would then lead to heart disease. So, I mean, think of applications of it. Think of the things we do for humans. And I think my challenge is think of drugs that would no longer be required. So that's kind of what I'm trying to deal with.
Oh, and that's a challenge, isn't it? Industry becoming obsolete and shareholders.
And anytime you bring something forward that's, a disruptor, there's going to be naysayers. There's going to be people who are trying to protect their existing profits.
Of course.
So pharmaceutical companies are very powerful in that way.
They're certainly very powerful. At Paleo FX, you shared the stage with the proclaimed father of biohacking, Dave Asprey. I know that he's a big advocate for stem cell use. He has many treatments. In his latest book, Game Changers, he spoke highly of stem cell therapies. In particular, one that caught my attention was the administration of stem cells directly into the vagus nerve. Is that possible to do so? He mentioned about resetting or recalibrating the fight or flight response with the nervous system. Have you seen that happen?
So we're not doing those treatments. I'm not sure which clinic he did, but he has stem cells bank for us, and he has received multiple treatments with us, which of course he shares on stage, so I'm not breaking any HIPAA. But yeah, there's so many things that you can do because, a lot of times what's happening is your body's getting into this over adrenal stress, like your adrenals are just kind of overworked. So being able to bring that adrenal stress down, making the endocrine system work more normally, that's all kind of hormonally based. And, we can certainly help to bring down your inflammation just by utilizing your cells naturally circulating, and by placing more cells circulating. It's kind of a win-win for patients.
Yeah. It's incredible. Why is there such an affiliation with Panama and stem cells and Mexico? There seems to be a lot of clinics around those areas, and I was chatting with somebody else, and they said that they saw that Tony Robbins went to Panama for stem cell therapy. Is it forward thinking as a place for stem cells, or is there a lot of great practitioners there?
So I think what happened is, a lot of practitioners are too afraid to do it in the United States because they get under scrutiny and they don't want to have a lawsuit from the United States of America like we did. So they took all the practices with regenerative medicine and cell therapy offshore. My opinion is, those facilities are great. They offer great treatments, but it becomes a treatment for the wealthy who are able to travel. And I just feel that's not in the best interest of the patient. So, the practitioners that I work with here in the United States, we continue to offer treatments here in the United States. We think it's important. I think there are patients that are not going to be able to get on an airplane, that are not going to be able to travel, that are not going to be able to pay the tens of thousands of dollars that those offshore clinics are charging. So, we're going to offer it here in the United States. And of course, we then are at risk of, the regulatory restrictions and lawsuits. And I suppose it's a risk that I'm willing to take just because I know of all the people that we're hitting. And, one of the other challenges is that the media tends to protect big pharma because it's who advertises with them. So unfortunately, in the media, we don't get fair representation. It's a very one-sided story that comes out.
No, very, very much so. I guess these platforms now are so vital. So podcasting and doing the tours with places like Paleo FX and all the other health and fitness summits where you can get in front of like-minded people and spread that message is so vital to, I guess, get in between any propaganda or bias in the media. Yeah, no, absolutely. Sure. With regards to sourcing a great provider, what would be the best kind of questions? Like, say, somebody like myself or a listener was wanting to get some stem cell therapies or advice. Are there particular questions they should ask when they go into a clinic?
I think most common things you want to look for are that they're addressing or that they have experience addressing the kind of condition that you have. For example, some practitioners focus only on orthopedics, so it wouldn't really make sense to go there if you have an autoimmune disease.
Yes.
So you want to look for practitioners that are, addressing the condition that you have. And then, of course, there's a variety of different sources of stem cells, and I don't necessarily think, that there's only one way to get from point A to point B. Point A being you don't feel well, point B being you do feel well. There's a lot of different ways you can get to that. So, you can use a variety of different regenerative medicine type treatments. And I would encourage patients not to think of the stem cell treatment in the same way that you think of a pharmaceutical drug or pill. This is not a quick fix. This is something that takes time. Just to give an example, a lizard that loses its tail takes 2 years to grow that little tail back. So if we're talking about remodeling or changing the cartilage in your knee, this could take years. It took you decades maybe create the arthritis. So one injection and done may not be a realistic outcome. You may need multiple treatments. You also want to look at all the other factors, making sure that you're detoxifying your life, everything from diet to kind of stress levels, etc. So it's really kind of a full picture to make sure that you're getting the most optimum results with regards to outcomes.
No, it's a really great point that you make there, because I see it so often in my circles. If people have health ailments or conditions, their expectation is the magic pill. They go to the doctor and they literally think that they're just going to be given either a prescription or a medication, or even if it's alternative medicine, they expect it to be healed immediately, and it's just not the case. It's like, I know personally, like with any health conditions, it's a process. So I wouldn't think the stem cells would be any differently. It sounds like they have amazing application with the inflammatory mechanisms that they work on. But I wouldn't expect that you'd grow new cartilage or a new kind of spinal kind of disc immediately. Yeah. But I'm sure you get it all the time with kind of expectations that are unrealistic.
Kind of been conditioned with chemical medicine where it's, you take a pill and something happens right away. It's not how you actually heal. And so different than a pill that you will take for the rest of your life, which is what all pharmaceuticals are. There's not one pharmaceutical that you just take one of it and you're cured. This is different. We're trying to actually get to the underlying cause, address damaged tissue, maybe push the reset button on the immune system. And so it has to be done with a variety of different modalities coming forward to create that healing cascade. Even if the stem cells are kind of like the initial spark, you can't stem cells and then go eat donuts all day long. You're working against yourself.
Yeah, probably won't support that mechanism. I know that fasting has been reported at helping increase stem cells within the body, but maybe not. Binging on donuts or pizzas or burgers might not be conducive to that.
That's right. Yeah. And I do think, I'm a faster. I do a lot of intermittent fasting. I think that's a great way to kind of kickstart and stimulate health. And, there's a lot of different things you can do to create a healthy environment. And then I think the thing I always encourage people to do is remember that you're an individual. And what your needs are going to be very different than the person next to you. So, just because intermittent fasting worked for person A, that doesn't mean that it's going to work for person B. We're all very unique. And I one time heard someone say that we are about 9/10 microbes and 1/10 human. So remember that our microbiome really kind of dictates what's going to happen and how we respond in our environment. So what's happening to you today could be very different in a year. So just because this year spinach is like your best friend and it makes you feel good, a year from now you might not have the appropriate enzymes in your gut to digest that. So allow yourself that flexibility and tap into and listen to what your body needs. I think that we've sometimes quieted that inner voice because we rely so heavily on chemical medicine and we forget to listen to our body.
Yeah, no, really, really good points. Do you envisage regenerative medicine, in particular stem cell therapy, being widely accessible for all populations in the future, or do you think that it will kind of remain only accessible for people with the funds to afford it?
I think that the cat's out of the bag. So even though there has been kind of a push to suppress it or stop it, there's too many patients at this point who have seen amazing results. So that suppression will not last for very long. And we're seeing this, so many countries embracing the concept of using your own stem cells as opposed to like an off-the-shelf bottled type product. And I think that's just going to continue to grow. Patients seek these treatments out, hence the Panama facilities, et cetera, doing so well. Patients are willing to travel to get these treatments. And eventually, the patients are going to have to be louder than the marketing machines and the media that are trying to press this and say, hey, we want this here. I mean, you're seeing some states in the United States are embracing that. For example, Texas has put some laws on the book to help allow patients to get these treatments in the United States. Been working with the political in Florida to see what we can do to get more protection for patients and allow them the right to try these therapies. Because ultimately, it is your body. You should be able to make a decision about what to do with your body without the government interfering.
Absolutely. I totally agree with that. And are there any regulatory bodies to support, I guess, patients or to maintain, I guess, quality? Because in Australia, I was looking into, the laws and regulations, and I believe that they are operating, but they're operating out of just small clinics, and I don't know if it's highly regulated. Do you have regulatory boards, or is it just you need to do your own due diligence and find kind of experienced practitioners?
So, our feeling is that the way we are doing protocols is a surgical procedure. The patient comes in, you remove the tissue from that patient and immediately put it back to that same patient. So any sort of medical procedure is regulated by state medical boards. So there are some very strict regulations in place to make sure that you are maintaining certain standards, cleanliness, sterility, etc. And then each state within the United States varies. So, I'm not sure exactly how it works in Australia, but I'm sure it's something similar. Anyone who is boarded, who is, approved to be a physician, a practitioner in the state, has to follow those laws, has to follow the surgical procedure laws. So this idea that the federal government would have to come in and deem your cells a drug and that it would have to then be controlled by pharmaceutical companies is really just overstepping of the federal government, and it's unnecessary regulations on something that's regulated that doctors have been doing for years. I mean, doctors relocate tissue on patients all the time. This is not new.
No, absolutely. Well, I'm going to throw it out there. I'm definitely going to, look at having some stem cells to help regenerate some of my old sporting injuries, maybe my brain as well.
Yes, absolutely.
bad footy knees and a banged up brain. So, Dr. Comella, I'd just personally like to thank you so much for coming on and sharing this with our listeners. If people want to find out more about you, but more so about getting some therapy and stem cell treatment, is it US Stem Cell Clinics is the best place?
US Stem Cell Clinic, no S, just clinic.
Just clinic?
.com. USStemCellClinic.com. Send a note. Any questions you might have, we'll do a complimentary consult as well. But even just send a note saying keep fighting. I also have an open Facebook page. It's Kristin with an I, Comella, PhD. Just sending me a note on Facebook is great. Just saying, please keep fighting. Don't stop, because sometimes it's a little challenging and I do want to throw in the towel. But for now, I'm in the fight.
No, absolutely. And look, I along with so many people, like when we saw you at Paleo Effects, could see the passion that you have for this, and obviously that you're doing an amazing job. So keep up that amazing effort and don't get beaten down with that, because it's a great cause that you're working for.
Thank you.
And it is a real privilege to have you on and speak about something that you are doing a fantastic job in. So hopefully we'll see you back out here in Australia. I know that you've been out here in the past. We were just chatting before we jumped on. So maybe a holiday and maybe come out and continue to spread that message.
Would love to.
Awesome. You have a fantastic evening over there.
Thank you.
Thanks so much. Bye.